increase it from another.
Okay,
This is not immigration, this is seasonal work where
we
people go
haven't heard from before. The doctor in the corner.
Hello, hi. Morning, my name is Anam. I'm a surgical trainee in central London. So as a doctor, I am very concerned about the negative impact that Brexit will have on our National Health Service. We all know that the NHS is overstretched. We haven't got enough staff members and we haven't got enough money coming into it. The problem with Brexit, we're at risk of losing not only our brightest doctors and nurses, but also our allied health professionals, so the physiotherapists, the radiographers, the porters and the clerical staff, all of whom form the backbone of the NHS. And simply increasing training numbers doesn't mean that those slots are going to be filled to create a homegrown medical workforce. Tuition fees are up, NHS bursaries are disappearing, and with the ongoing junior doctors contract debate, the idea of coming into the profession is just not attractive to high schoolers anymore. And having our EU colleagues on the workforce is not simply about service provision. We all learn from each other, which helps improve the quality of the healthcare that we are delivering. And finally, what I'm particularly concerned about is the impact that Brexit will have on research and innovation. So we are very dependent on EU grants and collaboration, and we need the sharing of ideas. And we need the movement of the greatest minds within Europe, so that we continue to advance the boundaries of medical knowledge, but also so that we continue to enhance the global influence that the UK is having in this field.
Okay, I will come to you in just a second, but first of all, Norman, tell us where we are with the NHS, and remember that big £350 million going to the NHS every week that was on the side of buses during the Leave campaign.
Well, there is a sort of debate in Cabinet. There are those like Boris Johnson who are convinced that once we leave, that money will be there. I think Philip Hammond is frankly deeply sceptical about that, which is why we've had announcements in recent days about Theresa May having a long-term plan and clearly signalling that there is going to be more money for the NHS because, you know, it was part of the Brexit deal that the NHS would get more cash, and it may not come from the EU, but clearly there is a view in government that it has to be found from somewhere. In terms of your concerns about the recruitment and EU staff, I mean, it is you know, when you talk to people in Jeremy Hunt's team, I think they are very aware of it. The kind of tilt amongst sort of Brexit ministers is that really it's time we start training our own people. And we cannot continually rely on particularly nurses from the third world, because that is depriving them, it is argued, of people who should be staying in their health systems. We shouldn't just be sort of hoovering them all up. So one of the ideas which is kicking around is that when we get the immigration proposals, employers could be taxed or have to pay a levy if they recruit from abroad. And the thinking is that levy would then go into training sort of homegrown UK staff. Now the difficulty, of course, is what you'll know better than me, it takes about 7 years to train a doctor, so there's obviously a time frame gap between being able to train all these people and what happens in the short term. But you know, I wonder when we get the final package whether there will not be special provision for the NHS, because it is, you know, so heavily reliant on staff not just from the EU but from the rest of the world.
Colin.